I'm Dr. John Sheehan and I'm a local GP working here on the north side of Cork City. And I, along with my colleagues and other healthcare professionals, are working here in the Community Assessment Hub. When you visit the Community Assessment Hub, you will see people dressed in protective equipment. And although this can be slightly strange for people, I want to reassure people that they will receive the same level of care and professionalism as they are used to. And we will work to the best of our ability to ensure their health and safety.
The referral process is very straightforward. It's for people who either have COVID disease or probably COVID disease and who contact their GP and the GP feels they need a more detailed assessment. The referral starts from the person's own GP. We send it electronically. You get your notification of a timed appointment, so you shouldn't be waiting particularly long. Your time within the hub will be kept as short as possible. The plan is that we will take some more details over the phone, checking their name, address, their medical history, their tablets, medicines. So ideally they'll have a list of those with them. And then once that is done, we will invite them to come into the centre. They'll be greeted at the door. We'll give them a mask to put on if that's okay, and we'll get them to sanitise their hands. So the nurse will talk about some maybe past medical history and their symptoms, and then take some important measurements like things like temperature and blood pressure and oxygen saturations. Once the nurse has completed her assessment, then the doctor will come in and take further history and possibly an examination, possibly not, and decide what the course of plan and how we're going to manage this particular patient. The doctor will then advise the patient on what to do next. In some circumstances, the decision will be to refer the person to the emergency department. In some circumstances, maybe the person is referred back to their own home with advice on how to manage and how to recognise if they deteriorate. We may also have supported self-isolation facilities, and some people may be suitable to go there. It's important that people understand that all the staff with whom they deal will be wearing full personal protective equipment, which is a mask, goggles, glasses, a visor possibly, and gloves. And that can be quite intimidating for patients, but this is standard to protect both the patient and the staff member. We do appreciate that this can be quite an intimidating, daunting process for many people, but we are working hard to make it as smooth and comfortable as possible for patients.